Doctors do not top the chart on sexual cleanliness. Do you go to the hospital and describe all of your symptoms to the man/woman who can never go medically wrong in your eyes? That familiar nod to your complaints, with keen attention paid to you and your complaints, which they help in finishing. They professionally supply you with medical terms while you speak in their office. The one who prescribes the right medication, and you instantly feel better even without having the medication just yet. In essence, everyone goes to the doctor at some point, to get checked, diagnosed and treated. Doctors are the superheroes of healthcare. They assume the position of knowing more things than ordinary humans, and they are supposed to also know how to avoid getting sick. And one major way to get sick is by contracting sexually transmitted diseases. Now this is where it gets weird. The doctors advise others to have protected sexual relations. They know the implications, they know the risk, but the need to satisfy their fantasies, from years of being stuck in classes, reading tables, reading halls/rooms, and office, has got them feeling left behind by the world, feeling uncool. There is a saying that doctors are everyone's type. Ladies of all walks of life approach doctors, and when these doctors are morally upright enough to say no, they do that to a handful of these ladies, before falling for 100 more of them. Remember that these doctors crave fun and excitement, and want to work and flex just like everyone. So the images in their heads are quick to recreate in person. So when it comes to sexual cleanliness, we assume that these doctors would set the standard for others to follow. They trailblaze the heck out of health issues, especially sexual health, but in reality, it isn't so. It is safe to say that doctors don't prioritize sexual cleanliness as we all expect them to. Studies have shown that doctors do not always practice what they preach, as they are constantly overwhelmed by interested and enthusiastic ladies and men trying to woo medical practitioners. The study surveyed a group of medical professionals, which includes doctors, nurses, and other healthcare workers, about their sexual habits and hygiene practices. The results showed that a significant number of doctors did not follow proper sexual hygiene protocols, putting themselves and their partners at risk of sexually transmitted infections, STIs. But why do doctors do this despite all they know? Why do they know, yet they carry on? What could be a realistic, non-judgmental reason why this happens? 1. Stress from busy schedules. Doctors work long, hard hours, which leads to fatigue and stress, which can compromise their attention to personal and sexual hygiene when faced with an appreciated opportunity to relieve their stress, and what they preach can be completely ignored or simply not remembered. 2. Need to experience things. Despite knowing it all, some doctors will believe that playing it safe all the time is boring, and will deprive you of some life experiences. For example, having protected sex always will deprive you of experiencing the feeling of unprotected sex, and this doctor will not want to not have fun. Remember that doctors always believe that life passed them by while they were becoming doctors, so they play catch-up a little too much. 3. Complacency. It is normal for doctors to assume that they can protect themselves since they protect others, and most probably prevent any adverse effect of unprotected sex from occurring. Effects like stays. This is complacency and neglect of their proper hygiene. Implications of these acts by doctors. Just like everything in life, there will always be implications for the choices of these doctors. When a doctor refuses to prioritize their health, these are some of the implications. 1. STI transmission. Doctors easily have the trust of many individuals, be it their patient or their ments. They just get the trust of people, and that is done easily. So there is bound to be an easy transfer of whatever disease the doctor has contracted. Sexual partners will easily transmit the STIs. This surprising is because people become too lazy or distracted to look after their bodies by themselves, and they tell themselves that the upright lifestyle of a doctor they are sexually involved with will keep them safe because doctors always do the right thing when it comes to sexual matters. So they get eased off the burden when they're in a sexual relationship with a doctor because the doctor is supposedly going to look out for him/herself, and in turn look after the partner and their profession. Pieces of advice. But that is where they go wrong because doctors can't be trusted. 2. Patient trust. When doctors do not prioritize their sexual health, and they eventually fall ill as a result of this, they will easily lose the trust of their patients, colleagues, and even superiors. Because they will pose a big challenge to the reputation of the organization which they work with. This can then lead to job losses and patient loss. 3. Public health endangerment. The multiplying effect of an STI can never be overemphasized. A person can successfully infect over 100 people within a week. With the fast pace of infidelity and sexual recklessness in society right now, people have so many sexual partners that they can't keep track of, and this circle continues to go around and around the world. There are already a handful of people who don't care about their sexual consequences. Adding a doctor to this equation is just going to worsen their situation. Society might not hold itself to as much standard as they hold doctors, which is why expectations are so high for doctors. Advice to society. 1. Don't assume that doctors are the cleanest people. 2. Don't be put at risk by your rigid assumption. 3. You only have the power to protect yourself. 4. Use protection, no matter the pressure. 5. Communicate openly. 6. Get tested regularly. 7. Prioritize your health. 8. Remember, doctors are not immune to STIs. 9. Stay safe and stay informed. In conclusion, while doctors are expected to be role models for health and hygiene, studies however suggest that this might unfortunately not be the case. Doctors shouldn't always give in to their temptations, but they are still humans. They don't only look out for themselves when they do this, they have a hierarchy of humans who get the trickles of their choices passed down to them. So ladies and gentlemen, keep your temptation far away from our healthcare heroes.